I'm Dr. Michael Zabel, and I'm a cardiologist with the LMH Health Heart Center. You know, the LMH Health Heart Center is staffed by some truly exceptional cardiologists that have trained at some of the best programs in the country. Most of us have quite a few years of experience. Most of my partners don't have as much gray hair as I do, but we're all highly experienced, and I think that the care we offer to patients is top-notch. I don't think you can go anywhere and get better care from the cardiologists and the nurses and the technicians than you can right here at LMH Health and at the Heart Center. Probably the three biggest areas of cardiology that I enjoy the most would be treating heart failure patients, patients with ischemic heart disease, coronary artery disease, blockages, obstruction in their heart arteries, and valvular heart disease, which we're seeing more and more of because that tends to be an age-related thing. As people get older, they tend to get more valve heart problems, and we're seeing more of that all the time. Those are probably the three big things that I do the most and probably enjoy the most. I would describe my philosophy of care as a collaborative one. You know, some people want to, you know, their goal is to be able to participate in a triathlon again. And other people, you know, their goal is just to be able to get up, back and forth to the kitchen without assistance. So, you know, being able to work with people to determine what they want, the style of care, the type of care, the aggressiveness of care, I think that's very important, and I think that type of collaboration is critical if you're going to take care of patients with heart disease. When patients come in to see me for the first time, they're almost always referred by another doctor, and they want to know, do I have heart disease, and how bad is my heart disease, and what can we do about it? And those are the things that we'll address with the first visit. We can almost always address those three things. You know, do you have it? What kind is it? How bad is it? And what are the options to treat it? I'd say the advice I give patients the most probably is, don't worry too much about this. You know, we can treat this. There's a lot of things in cardiology we cannot cure, but almost everything we can treat. And you know, a lot of patients don't know that that's the case. You know, they've been told they had heart disease. Am I going to die from this? You know, is there anything that can be done? And the answer to the last question is almost always yes. There is something that we can do about this.